We thought we'd come back on this week. Obviously, we did a video last week and just keeping you updated of what's happening at the Fountain Centre. But we asked if you had any questions or concerns that you wanted to ask us. So a few people have come back with some questions. So myself and Eileen are here to just to answer as best we can. And where we weren't sure of the answer, just to be rest assured we sought advice from the people that do. So all of the answers to the questions are valid. So the first question we had, Eileen, is a lot of people were worrying about basically coming to the hospital with COVID-19 and how safe it was and wanted some reassurance. So what was the...
So the hospital are doing everything possible to keep patients and staff as safe as possible. With respect to our oncology patients in St. Luke's, there's just one entrance now, and it's a secure entrance, which means it's manned by security, and it is only for oncology patients, and no visitors are allowed. So the footfall is very, very low. People are only coming in when they really have to. A lot of the clinics are virtual or telephone. So the people coming in need to come in, it's for treatment. And like I say, it's as safe and secure as they can possibly. And generally then within the hospital, the bigger hospital, the wider hospital, there's designated COVID wards. So they're keeping those patients together. And the staff that work with those patients stay in that zone. So there's no crossover, so the risk of cross-infection is as low as possible. If somebody turns up in A&E, and particularly if one of our patients wasn't well and needed to come to A&E, rest assured all the measures that they can put in place are in place. So when people arrive at A&E, they come in one by one, so they are assessed and triaged. And I think if there's any risk at that point, then they'll go down a different route, if you like. And also if an oncology patient should present in A&E, they will be moved immediately to a side room, again reducing any risk.
If you are an oncology patient and for any reason you need to go to A&E, please go. Don't let the fear of COVID or coming to the hospital stop you, because every precaution has been taken. You will be safe as you can be. The hospital, they've done everything that they can. So please don't stay at home if you need to be going to A&E. That's really the message that they want us to get across to you. We were asking about the Royal Surrey and how basically they're faring compared to other hospitals.
I think overall the Royal Surrey are doing really well. They're coping really well. The team have been amazing on that front end. And with respect to other hospitals in the areas, our numbers are, I think, relatively low.
And I think that's because of the planning, because the planning that went into everything
They started early with their planning.
They did.
I think what's really interesting is that they were in touch. They kind of got ahead of the game, as you say, and they took a lot of the learnings from Italy and embedded them in the practices here. So much so now that they're now sharing that with other trusts.
There you go. See,
so it's been great.
If anything, if you can use yourself as kind of a model for other hospitals, then you're doing something. Next thing, so some people were asking as regards the Fountain Centre and sort of about how we as a charity and how we're going forward and everything. So as it stands, obviously we can't raise any money at the moment. All of our and we do rely on fundraising to continue our service. But we're also unlucky that we are a bit luckier than some charities in that we have some reserves, but obviously those reserves won't last forever, and we do need to look into the future and fundraising, so we still need people to think about us when they want to raise money. And we're not getting obviously donations from people just generally as people come in for their treatments, things like that. So at the moment we're okay, but we do still need people to remember us and to raise money for us, because we have to think long term. We have to think beyond COVID, beyond when things start opening normally, and that's when we start offering our services, and that's when we're going, the money that we raise, if it's now or then, we need to keep raising our funds. So if you are thinking of raising money for a charity, maybe give us a wee thought now. I know you're probably saturated with charities asking for money, and we appreciate that. And things are really, and that's another thing, is things are really hard for people. People maybe not working at the moment, and so we're not going to be sending you any begging letters. I've always said every penny helps. It doesn't matter how much, how little you raise, and never more so than now. So just because we're not like begging you for saying please know that we do still want you to think of us. And another question people had was about the dreaded, this will probably stick here in this phrase, PPE. So there is enough in the hospital.
I think the message is the hospital's fine.
Yeah, I mean, if everybody, obviously at the start everybody was in the same boat, but actually there is PPE in the hospital.
Yeah,
the people who need the PPE will have the PPE. So that's keep that in your head as well. So another question was about wigs. So people are wondering if somebody's wondering if they need wigs at this time. Obviously we can't have our hairdresser come in as normal, our lovely Tricia, she can't come in as normal. But what she is doing, so the nurses are still referring patients for their wigs, but we're just sending the forms over to Tricia. Tricia works from at her home, she has like a wee studio. So she's still working, but she's chatting to people on the phone. But the majority of people, she's been able to speak to them virtually, she's chatted with them, and she's been able to, with their help, maybe she measures their head or gets them to measure things. That there's ways around these things, and she said so far everybody's been happy with what they've got. And another question we had, Eileen, was about level A. So if you don't know, the Fountain Centre has 2 levels. Level B is our main centre, and then we have a smaller satellite centre on level A in the radiotherapy department. So some people were asking, Eileen, what's happening with that?
We have, so level A is right beside radiotherapy. So what we've done is we've sort of designated that area to radiotherapy, so that radiotherapy can use it. And they don't use it much, but it means that if there's anybody that is showing any signs, they have there's 2 rooms there that they can actually put people in safely and away from anybody else. So I guess it's being used for that.
Yeah.
And it's not being used often, but the fact is they have an area now that they can take people to if there's any concern.
And all the areas that are being used, they're all going to be being deep cleaned.
And they're deep cleaned after
anyway, yeah. So if anybody's in that room that turns out to have COVID, even suspected, it's deep cleaned.
So the cleaning is amazing.
Now, I think also obviously support is really important for people, and there's lots of support there for our patients and for the various cancers. Massive thing is also for carers, because obviously they're living with this disease as well. So Eileen has been chatting with one of our coaches, Jackie, and she's going to put together. She's starting a carers group.
Yeah.
So Eileen, will tell us a bit
about that. So this is the group, exactly what Maria said. We see a lot of carers here, and it's a big job for them, and we appreciate that, and we do support carers through counselling and coaching and therapies. But we thought there's a real if we could get people together in a group, that would really help them as well. So we are now working with one of our coaches to run a virtual support group for carers, and it will run once a month in an afternoon, and it'll be a place for people to come and share their concerns and challenges with a qualified professional and accredited coach as a facilitator, and learning new ways of new things maybe, and sharing, and that whole process of sharing and learning from each other in a very safe environment, a non-judgmental space, and again it's virtual, so particularly for carers who are running around a lot, it's something that they can access at home. And hopefully new carers or anybody who knows carers, maybe encourage them to come along. Absolutely. So anybody who cares, who's the other cancer patient, cancer patients.
Just in case this video goes viral and people realise. It's for cancer patients. So I'll put all the information on our social media and on our website, so please keep an eye on that for further details. Now, just one last thing I wanted to say is just to remind you that we are still here. So the only difference is patients can't come physically into the centre, but we are still here. There's still somebody here every single day. So if you're needing to talk or you need anything, just pick up the phone, and there'll always be somebody here. Our counselling service is still running. It's all virtual, so it's telephone, it's Zoom, it's Skype, but it is still running. Our coaching service is still running. It's again virtual. but we are still running. We're still trying to do as much as we can. And we've also this week, I think we said last week about our website. So this week we've actually uploaded a few more videos to our website. So we've got a lovely simple hand massage video. So that again, if you're with somebody at home and you want to practice, it's just very, very simple, very, very gentle, but it can be so relaxing just giving somebody that. I mean, you've done it, haven't we? And it's lovely, it's really lovely if you wanted to give that a go. We've also uploaded a sort of exercise from Yanni, who is our cancer exercise specialist at the Fountain Centre. So she's done just a bit of an exercise routine. And you can do it at home, you can do it in your garden, and just with sequences of stuff just to keep you moving. Obviously, only do it if it's safe for you to do so. Don't do it without speaking to your doctor if it's something that you're not. We've also uploaded a yoga. So a lovely yoga session with Maria, who's our yoga teacher, followed by a lovely yoga nidra, which is kind of like a yoga meditation at the end of it. And again, if yoga is something you want to get into, Maria's actually doing that weekly. I'll put the link again below this website, on her website. And she's doing a session, I think it's a Thursday,
yes, for cancer patients.
Specifically for cancer patients, so specifically for cancer patients, and it's for that one's for a donation to the Fountain Centre. So if you want to try that, I mean, there's a lot, and we understand there's lots out there, but these are obviously people that we know and we trust. So next week we will be here again, and we'll be joined by Danny, who is part of the emotional support service. So if you have any questions around sort of the home, family, kids, maybe driving you a bit mad, maybe you're just going a bit stir crazy at home, anything at all, you want to ask our advice, what's going on in the hospital, again, any anxieties, anything at all, just give me the questions either down below or email me to mwakefield@nhs.net. And that's everything. It's a wrap. So nothing left to say, but please look after yourselves, please stay safe, and we look forward to seeing you soon.
Take care.
Bye.